Hi everyone, I just wanted to kind of create this video going over a component to your fixed prosthodontics activity because I think it's very important that you understand why the ordering of the prep appointment steps are the way that they are. Overall, for some reason, Chapter 50 Fixed Prosthodontics has been a major struggle for a majority of you. Out of all of the components that we've done so far and what we'll finish up with, this and endodontics are probably the two most important chapters for you to have a really good understanding of what they are, what it consists of, and its process. Just because if you have no plans on going into a specialty, then crowns and bridges are a huge part of what you're going to be doing as far as procedures that you're going to be assisting with in a general practice. Aside from restorations or fillings, crown and bridge is at the top of that list as far as procedures you're going to be doing quite often in your office, so it's important for you to understand it. Endodontics is another one. Again, a lot of offices choose to do their own root canals unless they're going to be really more of a challenge or a little bit harder, then they're more inclined to refer to an endo or a specialist for that. So with this, focusing in on your ordering of the prep appointment and what takes place in there, you had to watch the video that went through the preparation of teeth 18 and 19. And it was done for you to kind of get a sense in real time what that process looks like and why we're doing it the way that we're doing it. Then you had to place all of those steps in the correct order. And for the most part, some of you did better than others, I do have to admit, but it was also to get you to start to think about that whole process and to kind of say, okay, I'm going to start with this, then it makes sense to do this, 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 and this in this order. So with this, I would not be so strict when it comes to which order you placed anesthetizing the patient, taking preliminary impression, and taking the shade. Depending on the doctor, some doctors like to get the patient numb first once they're seated, medical history has been updated, vitals have been taken. You talk with the patient. The dentist will come in, talk with the patient a little bit, make sure they have an understanding of what's going to be taking place that day. Maybe kind of sharing with them or educating them on, what the process kind of looks like. And then they'll leave you to begin the process. It's always going to begin with taking preliminary impressions and taking a shade. Remember, it's important you have to take that shade before the tooth is prepped. So other offices prefer that the assistant, as soon as they're done updating medical history and taking vitals, that they immediately get started by taking the preliminary impressions, the opposer if need be, and also taking the shade. Then they'll come in, talk with the patient, get them numb, and then kind of wait for the patient to get numb. So I'm okay. I'm not going to be as strict if you put taking preliminary impression first, taking shade first, and then anesthetizing, or other way around, anesthetizing, shade, preliminary impression. That, as long as it's done in the initial portion of the appointment, that's going to be fine. So we got 1, 2, and 3 out of the way. Again, not concerned with if this is done first and that's done second. It can all be interchanged between anesthetizing, preliminary, and taking shade. Then we have building up the tooth if needed. That would be the next step. We cannot begin to prep the tooth and the margin unless there's adequate tooth structure. If there is not adequate tooth structure to begin with, then we're going to have to do the buildup first. It doesn't make any sense to prep the tooth and then we build it up, because then we're going to have to prep it down again. So it makes more sense, hopefully, to build up the tooth, and then any excess is removed and the tooth is prepped along with the margin. After that, we're moving on to prepping the tooth. We built up the tooth because it needed it. In our case, it needed to be done, so we're doing the build-up first. Then we're prepping the tooth with the margin. Then we're going to place the retraction cord. Okay, tooth has been prepped, everything looks good. The dentist has taken, a few looks at it in the mirror just to make sure it looks good all the way around. Then we're placing the retraction cord in there. Nothing else is done when that retraction cord is in there. So we're waiting. We're waiting 5 to 7 minutes. During this time, you as the assistant is getting all of the necessary material that you're going to need for the final impression ready to go. You have your syringe ready to go. You have your light-bodied material already loaded into your extruder gun. You have your tip placed on there so that once the dentist removes the cord, you're ready to go. You have that extruder gun in your hand. You do any rinsing that you need to. The dentist dries the tooth. You start dispensing that final impression material into your syringe as soon as that retraction cord comes out. So your retraction cord's removed. Then you do your final impression. And that's again where you saw the assistant in the video loading up that syringe, and then she hands it to the dentist. The dentist flows that light-bodied material around the tooth or the teeth, allowing it to get into that space that was displaced by the retraction cord. And again, we don't want to take a final impression with the retraction cord in, because the whole purpose is for us to be able to capture accurate anatomy of that prepped tooth. If the cord is still in there, that's going to hinder the light-bodied material to flow down into that space to be able to capture all of the anatomy that's going to be needed. So the retraction cord has to come out before the final impression is going to be taken. So once the final impression is taken, we're then going to start the process for making our temporary or provisional crown. From there, we're going to then try it in. We're going to make any necessary adjustments to it. So we're going to check contacts, we're going to check margins, and we're going to check the occlusion. And we're going to make any adjustments that we need to. Once that's done, we're going to seat the provisional or temporary crown with the temporary cement. Okay, that's going to be very important. We're going to seat the crown. As we're pushing the crown down, excess cement is going to squirt out the bottom of it, which is what we want because we want to make sure we have adequate cement in there. We're then going to clean that cement away from the tissue and that crown. We want to make sure we're very thorough when the dentist or us, if we're doing it, that we're making sure that we're clearing out all of that cement, because we don't want any irritation with the tissue, because that could hinder us being able to put in the final restoration, the permanent restoration in when it's time. So we clean out the cement, and then once again, we check occlusion. So not only do we check occlusion before we cement the temporary crown in, we also check it afterwards. And we're going to do the same thing when it comes to the permanent restoration. Same thing is going to happen with the permanent. Once we take the provisional off, the dentist tries in the permanent restoration, contacts are going to be checked, margins are going to be checked, and occlusion is going to be checked, and adjustments are going to be made. What can happen when the temporary crown or even the permanent crown gets cemented in is if it's not pushed down all the way, then it can be high, and we want to make sure that it's seated all the way. So we want to make sure that we're checking occlusion again, and again making any additional adjustments if we need to. It's perfectly okay to make adjustments to the occlusion once it's been cemented in, whether temporarily or permanently. It's okay for us to do that. And then after that, once we've checked occlusion for the temporary, We're then going to give our patients post-op instructions, how they're going to care for the temporary crown when they're at home and while we're waiting the 2 to 3 weeks for the permanent crown to be made. After that, we're going to jump to scheduling the seat appointment if it's not already done. Some offices, as they schedule the prep appointment, they will automatically schedule the seat appointment just to ensure that we have that time available for the patient to be able to come in to get that restoration. Again, it's going to depend on how busy the office is. Or if it's not done at the initial appointment where both the prep appointment's done and the seat appointment, then we'll do it after we do the prep appointment. Then we'll schedule that next appointment. And then after that, patient's dismissed, we complete our lab prescription, making sure it has all of the accurate information, the doctor's name or clinic name, phone number, patient's name, what the type of prosthesis or material it's going to be made, the tooth number or teeth numbers, the seat date, all of that information has to be on that lab slip, and it needs to be signed by the dentist. So hopefully after hearing how the sequencing should be, that starts to make a little bit more sense to you as to why we would do it in that manner. And your seat appointment is going to look, like I mentioned, very similar to this appointment as well, as far as what's being checked when and how often. And we always want to make sure that we're, with both provisional and permanent, we're removing excess cement, we're checking occlusion again, we're checking contacts again once it's been cemented on temporarily or permanently, just to ensure that it did get seated appropriately. So again, important for you to have an understanding of this process and why it's done in this manner. So with that being said, with this particular section of this activity, I went ahead and made this as a bonus question. Obviously, you would get the point if you got it all correctly, but I just didn't want it to really affect some of your grades as a result of this section here, because it was a little bit more of a challenge. And again, it was meant for me to kind of get a sense for what your thought process is when it comes to how this appointment kind of looks like. So again, bonus question, not really going to interfere with your how you did on the rest of this activity.